At University of Virginia Health System, we're for bringing advanced care closer to home. So we're bringing health knowledge directly to you with UVA Health System Radio. Here's Melanie Cole.
Heart disease isn't just a man's disease, but heart disease symptoms are often different for women. And would you know the signs and symptoms of heart disease when they happen? My guest today is Dr. Brandy Patterson. She's board certified in internal medicine and cardiovascular disease. Her specialties include women's heart health and general cardiology. Welcome to the show, Dr. Patterson. So let's start with heart disease in women. Number one killer. Tell us about heart disease in women and why it's so different than it is in men.
Well, every minute in the United States, somebody's wife, mother, daughter, or sister dies from heart disease, stroke, or another form of cardiovascular disease. So every year, more than 400,000 women in the United States die from heart disease. It is the leading cause of death in women and kills 6 times more women than breast cancer alone. So right now, more than 1 in 3 women is living with some form of cardiovascular disease, including nearly half of all African American women. And although heart disease death rates among men have declined steadily over the last 25 years, rates among women have fallen at a much slower rate. There are many potential reasons for this. However, women may not always recognize that they are having a problem with their heart because their symptoms may be much more subtle.
So speak about the symptoms, because really, Dr. Patterson, we women were always taking care of everybody else in our lives. And we get our men to go to the doctors, and we take our children, and we do everything for everybody. But we can't take care of everybody else. I always say we have to put our own mask on before we put the other kids' masks on. So we have to know these symptoms. They're so important, but we don't recognize them for what they are. We usually dismiss them as something related to stress or tension. So tell us these symptoms that differ in women.
That's right. So, and all of us have seen the movie scenes where a man gasps, clutches his chest, and falls to the ground. And it's always a man. But in reality, the heart attack victim could easily be a woman, but the scene may not be that dramatic. Instead, women may experience symptoms of dizziness, sometimes cold sweats, lightheadedness, sometimes just shortness of breath, pressure or pain in the lower chest or upper abdomen that they may think is reflux. They may have, quote, a GI virus going around with some nausea and abdominal pain. Sometimes upper back pressure or pain in one arm or both arms, in the jaw, or just extreme fatigue. And so, as I said, women may attribute these symptoms to reflux, an upper respiratory infection, GI virus going around, or just getting older. And the signs and symptoms can be subtle, but the consequences are deadly, especially if the victim doesn't get help right away. So it is very important for women to understand what their risk for coronary artery disease and for heart disease in general is. They need to learn what their personal risk is for heart disease.
So what are some steps that women can take to protect themselves and things that we can do to prevent heart disease?
And that's a good point. So heart disease is preventable. There are a few non-modifiable risk factors, meaning risk factors we can't change. And number one, that's our age. We don't have a choice. We're getting older. And as we get older, plaque does build up in the coronary arteries, and we're more likely to have heart disease as we get older. We can't change that. We can't change our gender. And we can't change our family history. We are born with the genes that we have. If you do have family members that have had heart disease, you are more likely to have it yourself, especially if they had it at a younger age. The risk factors that you can change, that you can modify, are those reasons why heart disease is largely preventable. Number one, smoking. Smoking really makes the plaque progression much more rapid in the coronary arteries. So don't even start smoking, and if you are smoking, quit. After quitting for just about a year or so, you really cut your risk by about half of having plaque progression that is accelerated. Number two is your blood pressure. Control blood pressure. Know what your numbers are. Number three is your weight. Obese, patients tend to have, and women in general, obese women in general, tend to have accelerated plaque progression. Know your cholesterol. And lastly, if you have diabetes, try and control it as best as you can. Get out and start an exercise program. Just walking at least 30 minutes a day, 5 days a week, at moderate intensity can lower your risk for heart attack and stroke. Modify your family diet if needed. Follow a heart-healthy Mediterranean diet. So you can see there are a number of risk factors for heart disease that are modifiable, and women do have the ability to adopt positive lifestyle habits. And as you mentioned, women tend to take care of everybody else in the family. And so if women tend to adopt the positive lifestyle habits in their life, they are more likely to have their significant others as well as their children adopt those positive, healthy lifestyle habits as well.
Absolutely. Great information. So well put, Dr. Patterson. What is Club Red, and how can someone get involved?
So Club Red is UVA Heart and Vascular Center initiative that is designed to help women understand and manage their risk factors for heart disease. It's free, and it's an online program, and it inspires women to live a heart-healthy lifestyle by providing them with expert health tips and recipes as well as fun community events throughout the year. And you can go online at clubreduva.com to learn more information.
So give us really some of your best advice about women who may already have heart disease. So we spoke a little bit about prevention, but now if they've already come up with it, whether it's genetic or just something that they've had, what can they do to treat it? What do you do for them?
So I'm a firm believer in regular health care provider appointments to ensure that the blood pressure, heart rate, cholesterol, diabetes are well controlled. And again, I can't reinforce it enough. Walking, exercising, anything that you can do to get up and active will help prevent the progression of coronary artery disease, and as well as eating a healthy Mediterranean diet. And in general, for women that have already had the diagnosis of coronary artery disease, whether it's obstructive or non-obstructive, in general, we prescribe the same regimen. Controlling blood pressure, cholesterol, diabetes, exercising, living a healthy lifestyle by eating a Mediterranean diet, and not smoking. So the things that we do to prevent heart disease are the same things that we do to help control progression as well. Of course, once women are diagnosed with non-obstructive or obstructive coronary artery disease, there may be more medications involved in treating and helping to prevent the progression as if you did not have any coronary artery disease. But it's something, again, that the healthcare provider follow-up on a regular basis can keep track of and tailor your medication according to your situation.
Dr. Patterson, in just the last minute or so, give us your best advice for women and heart disease and why someone should come to UVA for their heart care.
Well, UVA provides wellness and health for all women, whether or not they have coronary disease or are just looking to find ways to prevent coronary artery disease and heart disease. Their standards of care are amongst the best in the nation, and it truly is a wonderful place to come to for the best health care in the country.
Thank you so much. You're listening to UVA Health Systems Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening, and have a great day.
Multiple ongoing clinical trials and basic research. For example, in the cardiovascular division alone, we currently have over 17 open enrollment clinical research trials designed to make cutting-edge therapies available to UVA patients first. We also have experience in many heart transplants. In particular, at UVA, we performed more than 300 heart transplants since 1989, making us the top heart transplant center in all of Virginia. Our team has expertise in a wide variety of supportive therapies, such as ventricular assist devices, and is extensively involved in the development and application of heart failure medications and devices. Our experience really extends from the very youngest patients to the very oldest, and survival statistics for all of our cardiovascular programs meet or exceeds national averages. And those are just some of the few reasons why patients in general should come to UVA for their care.
Thank you so much. You're listening to UVA Health Systems Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening, and have a great day.